Okay, let's talk about epidurals and spinals during labor and C-section. There's a difference. There's a reason we do one or the other, or doing a general anesthesia for like a C-section. So when you come in and you're laboring, and you're doing a vaginal delivery, you have an epidural, and that's for labor, what we call labor analgesia. Analgesia means pain control. If you have a C-section, analgesia is not enough. You need surgical anesthesia, meaning you need enough anesthesia to not fill the surgical operation. So back to laboring, vaginal delivery, you get a lumbar epidural that provides analgesia for laboring. Now that epidural is in place. An epidural is a little catheter that sits outside of your this sheath outside of your spinal cord, and we give medications that numb that area. If you need to emergently go to a C-section, like a crash C-section because the baby or the mom is not doing well, you go to the operating room, and then through that epidural, we can give lidocaine or other medications that act very quickly and then give surgical anesthesia rather than labor analgesia through the epidural so that you don't fill the incision. So in this way, an epidural can be used for both labor analgesia and surgical anesthesia. Now, if you come in for like a scheduled C-section, you don't need an epidural because you're not laboring. You just need a spinal, which is a one-time shot that goes into your back that delivers numbing medications very, very closely to the nerves that provide surgical anesthesia, that numb up your belly, and it doesn't last for hours and hours and hours, and it's enough to provide surgical anesthesia for incision for delivery of the baby, and then it clears up. Now, if you were getting a C-section and you were not doing well, and if the baby is not doing well, and the spinal is starting to wear off, there are several reasons that then you need to go to a general anesthesia with a breathing tube. We don't want to do general anesthesia from the get-go. The whole reason we do an epidural or a spinal and keep the mother awake is we don't want the anesthetic going to the baby, because those anesthetics are sedatives, and that baby can wake up and maybe not do well and have poor APGAR scores. So we try to avoid a general anesthesia at all costs.